Hello everyone, my name is Pepet Pujahastiwi. Today I would like to present about the language and brain, and the special topic is the aphasia. Okay, so this is my mind maps, and you can see there are the causes, types, and effects. So I will talk about the aphasia, the definition of aphasia. The aphasia is an impairment of language that affecting the production or comprehension of speech and the ability to read or write. And then the causes of aphasia, usually it's due to injury to the brain, the stroke, head trauma, brain tumors, and infections. And then there are some types of aphasia. The best known of the types are global aphasia, broadcast aphasia, Wernicke's aphasia, and mixed non-fluent aphasia. The effects of aphasia is the production or comprehension of speech, the ability to read and write. Aphasia affects the retrieve the names of objects as well, and then it affects to put words together into the sentence. And now we will talk about the types of aphasia. The first one is global aphasia. Global aphasia is typically involves major damage to the front and back of the left side of your brain. The causes of global aphasia is injuries to multiple language processing areas of the brain, and it can be seen immediately after the patient has suffered a stroke or a brain trauma. And people with global aphasia usually can be seen by the symptoms of have severe problems using words, have severe problems understanding words, and then have limited ability to use a few words together. And this aphasia is quite the most severe disorder of aphasia. And the second one is broadcast aphasia. Broadcast aphasia results from damage to a part of the brain called broadcast area, which is located in the frontal lobe, usually on the left side. It's one of the parts of the brain responsible for speech and for motor movements. It's named for Pierre Paul Broca, a French physician who discovered the area in 1861. The broadcast aphasia is also referred to as expressive aphasia. What causes broadcast aphasia? Broadcast aphasia caused by stroke, brain tumor, injury to the brain, such as from a severe blow to the head or gunshot wound, and then infection in the brain, and then it's the progressive neurological conditions such as Alzheimer's disease. People with broadcast aphasia has the symptoms such as poor or absent grammar, difficulty forming complete sentences, omitting certain words, difficulty in articulating sounds and words, difficulty repeating what has been said by trouble with writing sentences, difficulty in reading, and problems with full comprehension, and difficulty following directions. And the last one is because of the frustration. So the third aphasia is Wernicke aphasia. It is the most common type of fluent aphasia. It occurs when the left middle side of the brain becomes damaged or altered. This part of the brain is known as Wernicke's area, named after Carl Wernicke, a neurologist. Wernicke's area of the brain controls human language. It's also near where we stroke our personal dictionaries. Someone with Wernicke's aphasia may have difficulty processing the meaning of spoken words. So they basically they know the sentences, and they can speak fluently, but it's less in meaning. So what causes Wernicke's aphasia? It usually caused by head trauma, tumors, infection, neurological disorder, and it's also possible to have aphasia that comes and goes. This may be caused by migraines, seizure, or other medical conditions. And what are the symptoms of people with Wernicke's aphasia? It can be seen by the string words together, make sentences that don't make sense, make up words that have no meaning, be unaware of the mistakes in their speech, deliver words in a normal melodic line even though the content may not make any sense, articulate their words normally, have difficulty repeating phrases, add words when trying to repeat someone, and interrupt others and speak rapidly. And it comes to the last one of aphasia. It's the mixed non-fluent aphasia. Mixed non-fluent aphasia applies to persons who have sparse and effortful speech, resembling severe Broca's aphasia. However, unlike individuals with Broca's aphasia, mixed non-fluent aphasia patients remain limited in their comprehension of speech. Similar to people with Wernicke's aphasia, individuals with mixed non-fluent aphasia do not read or write beyond an elementary level. And what causes the mixed non-fluent aphasia? It can be causes due to the damage that is near the language centers of the brain. The language centers include Broca's area responsible, which is responsible for language production, and Wernicke's area that is responsible for language comprehension. However, it is not due to damage directly to those areas. Rather, it isolates those areas from the rest of the brain. And then the symptoms of the mixed non-fluent aphasia, it can affect two things, yeah, like the expressive communication that includes speaking in short, incomplete sentences or phrases, speaking in sentence that other can understand, using the wrong words or nonsense words, and then using words in the wrong order. And it also can affect receptive communication that include difficulty understanding other people's speech, difficulty following fast-paced speech, and misunderstanding figurative speech. Okay, so that's all from me about the language and brain in psycholinguistics, especially about the aphasia. And thank you for your attention. Have a good day, everyone.